another place on the earth and help to welcome me for our another keynote, Dr. Malcolm Paul Agius Galea, Parliamentary Secretary, Ministry for Health at Government of Malta. Please help me to welcome Dr. Malcolm.
Good morning. It's a pleasure for me today to be here in front of you all. And I would like to exchange and share some ideas and our visions regarding digital innovation and healthcare. Particularly, I come from Malta. It's a tiny island in the Mediterranean, strategically positioned between Europe, Africa, the Middle East. And our strategic position has always given us a big room for collaboration, both culturally, strategical, economy. Basically, our position has always kept us as a hub in the Mediterranean. And nowadays, we're looking forward towards other forms of innovation, particularly in the health sector. And it stems from the fact that Malta has become actually one of the super-aged countries in the world. Well, for a country to be super-aged, it must have at least 20% of its population who falls under the realm of an elderly person, that is, above the age of 65 years. At the moment, we've got 20.4% of our population, which is above 65 years, and about 25% of our population is above the age of 60. By year 2050, probably more than a third of our population is going to be above the age of 65. And so that is a challenge in itself, because we must incorporate this issue into our own healthcare vision. And in fact, Malta has got three main particular demographic challenges which is leading to this. First of all, we've got an increasing population. Particularly in Malta, probably like here in the UAE, we've got an ever-increasing migrant population, migrant workers. In fact, even though the average age of the Maltese population, the endemic Maltese population, is going up, the mean age of the whole population is going down. Why? Because there's a whole migrant population who are coming in, and they're pushing the mean age of the whole population downwards. And that in itself is creating a particular challenge as well on our own healthcare system, because these people must access the healthcare. So the healthcare system must cater for them as well, for the ever-increasing population. But a person who is elderly, by default, is going to seek medical care much more than a younger person. And in fact, elderly people have got chronic diseases. Chronic diseases present a particular field in medicine which needs constant care and constant monitoring. I am a GP by profession, a family physician by profession. I've been practicing family medicine for the past 17 years in my own village. So, policy, my mission is beyond policy making. I am much more inclined into the personal and the life of the person himself. So what is our vision? Our vision is to keep as much our elderly within the community and with adequate management of their own chronic conditions to keep them independent in their own communities. And that's where digital innovation and technology comes in, particularly in the elderly field. Because what do we need to do? we must provide systems which ensure that these people are safe, they're well cared for, whilst they're still remaining in the community, in their own environment. And that's what the Maltese government is trying to do. We're always investing in digital technology, getting state-of-the-art machines, latest MRI machines. But as well, we're always investing as well in the chronic disease management with new innovations, particularly, for example, I'm giving an example, obviously dementia is one of the main challenges in the elderly sector, and you have to keep these people in the communities as much as possible. For example, we have invested in telecare on the move, that's what we call it, telecare on the move. It's practically a fob, which is basically giving us a geolocation of the person where he is. And they can remain independent in the society. But since it has got this geolocation, if the person himself goes outside the village, it will alert his relatives. And that in itself is promoting independence. The demented person can still stay within the community because, as most of you know, if you take that person out of the community where he is accustomed to, his dementia will get much worse. So we try to keep these people as independent as possible. Besides that, we're looking as well into other forms of digital innovation. For example, smart homes. By smart homes, I mean having particular sensors around the house, whilst keeping the person's personal life as much as possible. But you try to monitor the person himself whilst he's staying in his own household by using different sensors which can monitor his positions, his daily way of life, and basically you can monitor if there has been any changes, and that will alert us. Well, technology is endless. I know I'm in front of a particular population where you've got old brains, and that's where the government comes in. Because we must welcome you all into this ever-growing field, this nice field, where you can help us with your own ideas, with your own digital knowledge, so that we provide a better way of life for all of our population, and particularly the elderly. Especially Malta now, in its own world, we're trying to keep abreast with these digital innovations, artificial intelligence, and we welcome you. We welcome you to invest, and we keep ourselves at the forefront of digital innovation and healthcare. Particularly, we've got as well the Malta Enterprise, which is offering a lot of incentives for startups, and we look forward, especially here, the UAE, Saudi Arabia, the Arab countries, so that we collaborate together, especially when it comes to digital innovations. For example, as well, we look forward as well to have exchange of ideas, pooling in of ideas, particularly as well with having the new studies going on, cohorts. We provide the cohorts of people, and then we can help the technology to move on. I would love to congratulate you all, and I would like to thank Dr. Dillon himself, who is a fellow Maltese doctor, and we've known each other for a long time now. He comes from the surgical field, I come from the medical field, but we've both got at heart the people's health, technology, and the way forward for us all. Thank you all. We look forward for new ideas, and we'll keep on integrating together, and I'll listen to some new and very interesting presentations which are going to be held now. Thank you.